Welcome to the Move and Improve Health Program. The program is designed for adults ages 35 to 85 in Cleveland County and current patients of participating primary care physicians of the Norman Regional Health Systems Network. Physical inactivity is a major public health problem worldwide. A sedentary life is linked to so many chronic diseases, including heart disease, obesity, diabetes, and even mental health conditions like anxiety and depression. Today, we have more people sitting than we have ever before. We see these major health issues in Cleveland County as well. Recent studies have shown that heart disease is already the third leading cause of death, beginning at age 35. Even though Cleveland County has lots of access to physical activity opportunities like pools, parks, gyms, and sports, still 30% of residents report not doing any exercise in the last 30 days. It tells us access is not simply enough. In fact, it is harder to engage in exercise the older we get. And for those already living with a chronic disease, there must be more we can do. The Move and Improve program was designed to help this issue. Its mission is to empower sedentary adults to be physically active through policy, promotion, and education. Our goals are to increase access to preventative services for physical activity-related chronic diseases and to increase the percentage of adults meeting those ACSM-recommended physical activity guidelines of 150 minutes a week and 2 days of strength training per week. To meet goal number 1, our process objective is to partner with 10 primary care physicians within the Norman Regional Health System Network in Cleveland County and 10 certified health education specialist coaches. The behavioral objective. During the first month, 100% of the primary care physicians will begin using the physical activity as a vital sign system in routine healthcare practice. This will help us identify earlier those who are at risk of chronic diseases based on their sedentary lifestyle. Learning objective. By the third month, PCPs will be able to communicate 5 benefits of physical activity as preventative and disease management strategies to their patients during routine visit. Environmental objective. By the first month, PCPs will use Category 3 CPT codes to refer patients to the CHES Health Education Specialist for exercise counseling. They will be able to use insurance reimbursement for counseling services, which keeps the cost low for patients and overcomes any perceived cost barriers they may have. Outcome objective. By the end of the program, PCPs will have referred 25 patients to exercise counseling. To achieve goal number 2, our process objective is, before the program begins, to choose 10 locations to host our physical activity promotion events and establish our partnerships with 10 certified health education specialist coaches. Learning objective. By the 6th month, 80% of patients will be able to demonstrate 3 strength training exercises correctly. Behavioral objective. By the 6th month, 50% of our patients will record 150 minutes a week of activity. Environmental objective. By end of program, 10 free physical activity promotion events will be held at our chosen locations throughout the community. Outcome objective. 3 months after program ends, 75% of patients will still be meeting physical activity guidelines weekly. Interventions. Implementing the use of the physical activity vital signs system into routine patient care and utilizing physician referrals to exercise counseling services. Exercise counseling is a well-known behavior change strategy. It is so effective. The certified health education specialists, also known as coaches, are equipped to use the stages of change model when assessing a patient's readiness to change their behavior. They use motivational interviewing as well as SMART goals to help the patient customize achievable goals for them to work their way up to meeting the physical activity guidelines. Exercise counseling is not a one-size-fits-all prescription. Coaches consider patients' fitness level, if there's any underlying disease, their personal preferences towards what type of activity they would like. If they have any positive or negative attitudes or beliefs towards exercise, they help them walk through that. And they'll even consider their time constraints, their work schedule, and their family life into customizing a plan for them. Coaches also use this social cognitive theory, utilizing both positive words of affirmation and encouragements, as well as tangible and timely incentives that motivate patients to continue in their behavior change progress. Some additional tools for effectiveness is text message check-ins from health coaches to patients tracking their exercise in their weekly journals, growing in their education and skills through the exercise demonstration classes, the brochures, and having peer support at group exercise classes and promotional events held throughout the year. Our 10 physical activity promotion events that will be held throughout the year are a part of a larger social media campaign to positively influence the social norms around physical activity in Cleveland County. Our resources are the Norman Regional Health Systems Network and their physicians, the Certified Health Education Specialists used as health coaches, our coalition members, our local businesses, and the City of Norman and more, as well as our wonderful volunteers. Patients will receive the most benefits from this program, including an increase in their self-efficacy and their confidence, improvements in their mood and their sleep, better circulation, muscular strength and endurance, of course weight management, and also blood sugar regulation is more balanced, lowering the risk of diabetes, heart disease, and obesity. They'll also see a lowered cost and healthcare expenses. The community will experience lots of benefits as well from the program, including more people utilizing those 10 locations across the county, lowered healthcare-related expenses for the taxpayers with less emergency room visits and disease management expenses, and a more healthier, vibrant community. Physicians can expect to see an improvement in patient vital signs overall, and possibly better disease management skills and compliancy to protocols, as well as fewer prescriptions, and just better attitude towards their health and disease management. Some ways you can be involved is speaking with your healthcare administration and networks about utilizing the PAV system into routine care, or as a patient, speaking with your physician about a referral to exercise counseling with a CHES health coach, or lastly, gather people from your community and host a promotional physical activity event in your city or even in your workplace. Thank you for learning about our program today. Remember, get moving and improve your health.